Hi, I'm Donna. I'm the Chief People Officer here at University Hospitals of Coventry and Warwickshire NHS Trust. I'm delighted on behalf of the Trust Board that we're introducing this new enhanced compassionate leave policy. Through this policy, we are providing enhanced leave to our staff when they suffer from bereavement, enhanced leave for parents of premature babies, enhanced leave for those who suffer from pregnancy loss, and also enhanced leave for those who are undergoing fertility treatment. Every member of Team UHCW goes above and beyond every day to provide the best care for our patients, and I'm delighted that we can provide this same support to our staff during the moments that matter.
Hello, my name is Simon Betteridge and I am Head of Compassionate Community Development here at UHCW NHS Trust. Throughout my time working in the Trust, both as a chaplain and now in my wider role, I've had the privilege to support families through different forms of bereavement and loss. Often that's been through the loss of a baby or a child, and for other forms of bereavement and loss that have been difficult. Throughout that experience, one of the things I've recognised particularly is that that experience of loss is very different for people in different circumstances. Within that context, the space to react and to deal with that loss and to be able to do that in a way that is appropriate to you and your family is really important. The Trust have been having an ongoing conversation about how we support staff better and how we enable staff to live through those experiences and those losses and those experiences of illness within their families and their broader life in a way that is more appropriate and more flexible for them. So as part of that, the Trust are proposing a new compassionate leave policy. And that will mean an extension of up to 10 days paid leave for people. There'll be no upper limit on what that might mean in episodes in a year. And one of the most important elements of that will be introducing updates to the way that we deal with staff who have experienced the loss of a child, and what that means for them. That will mean that they can have 2 weeks paid leave as well as the 10 days for bereavement leave. And we want all of these things to not just be details of a policy, but we want them to speak also into a situation and say that the culture of the Trust and the way that we want to enable people to deal with their loss and the way that we want to treat them, that this actually says something different about that. And that actually it says to people coming to work in this Trust that in the most difficult experiences for them too, that the Trust is there for them and wants to support them and wants to understand the needs and the particularities of their loss, their experience and their family.
Hello, my name is Holly and I'm the Nurse Manager here at the Centre for Reproductive Medicine UHCW. University Hospitals Coventry and Warwickshire is at the forefront of fertility with some of the highest clinical pregnancy rates here in the UK. We work in partnership with the Biomedical Research Unit of Reproductive Health with the University of Warwick. We know that a lot of women do struggle to conceive, and with this in mind, some of our staff here will also be our patients. To support those undergoing fertility treatment, we are introducing compassionate leave policy of 5 paid leave days in a 12-month period. I'm proud to work for a trust that is inclusive and compassionate, and I fully support this leave policy.
Hi, I'm Steph Carter and I'm one of the lead bereavement midwives for the Trust. Experiencing pregnancy loss can be very traumatic, and every pregnancy loss is a bereavement, which includes miscarriage, ectopic or molar pregnancy, stillbirth and neonatal loss. To support our colleagues who experience the loss of a baby, we have signed up for the Miscarriage Association's Pregnancy Loss Pledge, and I'm proud that we will be the first NHS Trust doing so. As part of this, we are also offering colleagues that were pregnant and experienced loss up to 10 days paid leave, or the equivalent of 2 working weeks if they work on a part-time basis. And we are offering 5 days paid leave for partners and paid time off for any appointments linked to pregnancy loss. This recognises that pregnancy loss impacts the whole family and that we understand the emotional impact it can have on our staff.
Hello, my name's Gaynor Armstrong and I'm the Director of Midwifery here at University Hospitals of Coventry and Warwickshire. I just wanted to share with you how our trust has signed up to the charter supporting parents of premature babies, and we will be added to the employer's wall of fame with regards to sharing this. So far, only 8 other NHS trusts have signed up to this charter, so I'm incredibly proud that we at UHCW are amongst those that are leading the way. By signing this charter, we've agreed to extend maternity leave for mothers of babies who are born prematurely by the number of days that the baby is born before their due date. In addition to this, partners of women will also be given up to 2 weeks paid compassionate leave on the birth of their premature baby or babies. So paternity leave can be taken then at a time when the baby or babies go home. In addition, we will offer support to parents of premature babies when they return to work through the consideration for all flexible working patterns, and this hopefully will help to reduce their pressures and give their colleagues the chance to focus their efforts on their new family. We obviously are really proud as part of the maternity team to support this really important charter.
Hi, my name's Denise Crampsey. I'm Joint Staff Side Chair here at UHCW. We just wanted to tell you all that we stand in partnership with the Trust and see the launch of the new compassionate leave policy as a very positive move in supporting our colleagues in times when they need it the most. The policy will give our colleagues the time they need to come to terms with any loss that they may experience. Unfortunately, we all suffer loss in our lifetimes, and it's one of the most difficult times in our lives. So this policy also enables our teams to put their health and well-being first in often the most difficult times of their lives and receive the care that they need.